I am Dr. Dinesh Kansal. I am heading the Department of Gynaecology at BLK Superspeciality Hospital, and I am a laparoscopic gynae surgeon, also into hysteroscopic surgeries. Today I am going to tell you what is the scope of surgeries specifically when infertility is concerned. Infertility is a common problem of women, that is not having a child. So always infertility is first treated medically. We do the test, give medication, do the follicular monitoring, but if the patient does not become pregnant, then of course we have to go further. A very common problem is fibroids, that is usually non-cancerous tumors in the wall of the uterus, which can be tackled either laparoscopically, that is we make small keyholes in the abdomen, and through specific instrument and telescope we are able to shell out the tumor and remove it through a bag so that it does not spread and the patient can become pregnant, so that there is no irregular pressure on the pregnancy and there are no bad substances which can harm the pregnancy. And suppose the fibroid is growing more towards fibroid, or you can also call myoma. If it is growing inside the uterus, then we remove it hysteroscopically. That is, suppose this is the uterus, we go from below, have a look inside and then scrape it bit by bit from below. So depending upon the position we decide laparoscopic or hysteroscopic. Aim of both is to give a good uterine shape so that the fetus can remain there without much chances of abortion. Another common thing is endometriosis, that is uterine lining which gets deposited in the pelvis near the ovaries and the tubes in the pelvis. So it causes pain every time the patient gets periods, and the pain keeps on increasing over the years. About this is a very specific cause for infertility and very common also. And no medical treatment, almost always it has to be surgical management. So for this, if they are ovarian masses, cyst-like things, we remove the cyst, or if they are implants, endometriotic, we fulgurate them. If the things have got stuck together, like ovaries and the rectum, everything sticks behind the uterus, so we separate it. So this is about the endometriosis. So we try to bring the tubes and ovaries normally, so that when the egg gets released from the ovary, it gets picked up by the tube easily. Other causes are, suppose it's a tubal block. If it's just a flimsy block, maybe we can correct it hysteroscopically, which is called tubal cannulation. We may not be 100% time successful, but whenever it is it's a golden thing for the patient. Just with a minimal procedure, patient's tubes open and she doesn't have to go for IVF. And another is, suppose the patient had done sterilization, like she doesn't want more children, and we've closed the tubes by a ring or cautery, and now she wants more children due to mishap with one of the children, or she's changed her mind, then that also can be done laparoscopically. We cut out the wrong segment or the fibrous segment of the tube and unite the healthy ones. So this is called tubal anastomosis. And it can be best done robotically because we can take real fine sutures and good approximation in this case. So robot is really good, especially for tubal anastomosis and severe endometriosis, because we can have wonderful 3D vision and we can do a fine surgery to give the best results to the patient. Similarly, suppose somebody had a copper inserted and now she doesn't even remember, or the threads have gone inside and she wants to become pregnant, then also we can put a hysteroscope and then hold it with a grasper and take it out. So these are beautiful minimally invasive procedures which we do for infertility. Also, suppose the patient had abortion and she keeps on having irregular bleeding, and when we do ultrasound, there is a small bit of tissue inside and it gives rise to a lot of vascularity, lot of blood supply, which becomes irregular and like a bunch of vessels, which sometimes is misnamed as arteriovenous malformation, where they are advised to have hysterectomy No, please, no, don't go for hysterectomy. They are almost always retained products of conception. Sometimes you see it's just a tiny product and it is giving this picture which is similar to vesicular mole or arteriovenous fistula. So here again we go hysteroscopically, just pinpoint where the products of conception and then take it out. Rather than doing simple DNC where we can miss the tissue itself and destroy rest of the endometrium, the best is to be very specific, do a hysteroscopy and then remove the products. I think I've explained most of the things, but still if any queries regarding any of the procedure or in your case specific query, sometimes the patient has 2 problems, 3 problems, adenomyosis, fibroids. So we can discuss what is to be done about it. We will definitely answer your queries and solve your problems. Thank you.